Anatomy. Upper limb gunshot points or bullet points. Bones of upper extremity. Largest carpal bone is capitate bone. Ossification center for lunate appears at 4 years. Ossification center of pisiform bone appears at age of 12 to 13 years. Third metacarpal has epiphysis at head. Joints of upper limb. The term dynamic stabilizer of shoulder joint is used for rotator cuff. Subscapular bursa communicates with shoulder joint. Pectoralis minor has no action at shoulder joint. The main action of pectoralis minor muscle is to move the scapula or shoulder blade. Metacarpophalangeal joint is functionally defined as ellipsoid synovial joint and structurally saddle joint. Upward rotation of glenoid cavity during overhead abduction of shoulder occurs by trapezius and serratus anterior. Rupture of supraspinatus manifests as difficulty in initiation of abduction. Wrist joint is an ellipsoid joint. Wrist joint is formed by articulation of lower end of radius, articular disc and carpal bones, scaphoid, lunate, triquetral. Adduction of hand at wrist is done by flexor carpi ulnaris and extensor carpi ulnaris. The weight of upper limb is transmitted to axial skeleton by coracoclavicular ligament. Nerves of upper limb. Suprascapular nerve is a branch from upper trunk of brachial plexus. Root value of thoracodorsal nerve is C6, C7, C8. Median nerve carries fibers from all roots of brachial plexus. Eps point is at junction of C5, C6. Klumpke's paralysis involves C8 and T1. Median nerve. Median nerve is also known as laborer's nerve. Median nerve injury at wrist is commonly tested by contraction of abductor pollicis brevis. Median nerve injury at wrist causes loss of opposition of thumb. Compression of nerve within carpal tunnel produces inability to oppose the thumb. Pointing index sign is seen in medial nerve palsy. Ape thumb deformity is seen in involvement of median nerve. Nerve damaged due to lunate dislocation is the median nerve. Median nerve injury at elbow affects flexion at DIP joints of second finger, flexion at PIP joints of third finger, and flexion at DIP of first fingers. Ulnar nerve. Deep branch of ulnar nerve supplies adductor pollicis. Loss of extension of little and ring finger along with hypothenar atrophy is seen in injury of ulnar nerve. Froment sign is characteristically seen in ulnar nerve injury. Claw hand is caused by lesion of ulnar nerve. Lower ulnar nerve palsy is characterized by increase in severity of claw hand. Ulnar paradox. Injury to ulnar nerve at wrist causes paralysis of adduction of thumb. A cut injury of ulnar nerve results in loss of all interossei. Wasting of intrinsic muscles of hand can be expected to follow injury of ulnar nerve. Adduction of thumb is lost in ulnar nerve injury. The term Gouin's canal is in relation to ulnar nerve. Radial nerve. Damage to radial nerve in the spiral groove spares long head of triceps. Injury to radial nerve in lower part of spiral groove leaves extension at elbow joint intact. ECRL will be paralyzed when radial nerve is injured just below the spiral groove. Wrist drop is due to injury of radial nerve. The thumb action that is totally affected in radial nerve trauma is extension. Lower lateral cutaneous nerve of arm is a branch of radial nerve. Other nerves. Axillary nerve supplies the deltoid plus teres minor. Carpal tunnel syndrome is due to compression of median nerve. The nerve supply of nail bed of index finger is median nerve. Muscles of upper limb. Perforating branch of internal thoracic artery supplies pectoralis major. Serratus anterior muscle helps in forced inspiration. Winging of scapula is due to paralysis of serratus anterior. Teres major muscle is supplied by lower subscapular nerve. Latissimus dorsi is inserted into floor of intertubercular sulcus or bicipital groove of humerus. Anatomically, a muscle of upper limb but functionally related to the trunk is latissimus dorsi. The muscle that crosses both the shoulder and elbow joint is biceps brachiae. Biceps brachiae is supplied by musculocutaneous nerve. Coracobrachialis is pierced by musculocutaneous nerve. Lumbricals originate from tendons of flexor digitorum profundus muscle. Vessels of upper limb. Occlusion occurs at second part of axillary artery. Blood flow is maintained by anastomosis between deep branch of transverse cervical artery and scapular artery. Arteries forming anastomosis around surgical neck of humerus take origin from third part of axillary artery, that is anterior and posterior circumflex humeral artery. Anastomosis around the shoulder is for connection of first part of subclavian artery with the third part of axillary artery. Nerve running along with profunda brachiae artery in spiral groove is the radial nerve. Interosseous membrane of forearm is pierced by anterior interosseous artery. Recurrent interosseous artery is a branch of posterior interosseous artery. Important spaces and structures. Lateral border of cubital fossa is formed by brachioradialis. Abductor pollicis longus and extensor pollicis brevis form the lateral boundary of anatomical snuff box. Radial artery is a content of anatomical snuff box. Nerve related to anatomical snuff box is superficial branch of radial nerve. Radial bursa is the synovial sheath covering tendon of flexor pollicis longus. Infection of index finger spread to thenar space. Breast and axilla. Level 3 axillary lymph nodes is the apical. Clavipectoral fascia is derived from costocoracoid membrane. Lymphatic drainage of upper outer quadrant of breast, anterior axillary lymph nodes. Some very high yield updated upper limb gunshot points. Lateral end of clavicle is flat, where it articulates with acromion at acromioclavicular joint. Trapezius attaches to the lateral third of clavicle, acromion and spine of scapula. Deltoid attaches to the deltoid tubercle. Conoid ligament attaches to conoid tubercle. The subclavius attaches to subclavian groove and trapezoid ligament attaches to trapezoid line. The spine of scapula continues laterally as the acromion. Radial styloid process is much larger than ulnar styloid process and extends further distally. Glenohumeral joint itself represents the true shoulder joint, whereas the scapulothoracic joint, which is the conceptual joint, is a location where scapula moves easily on the thoracic wall. Scaphoid articulates proximally with radius and has large tubercle. Lunate articulates with radius and is broader anteriorly than posteriorly. The triquetrum articulates proximally with articular disc of distal radio-ulnar joint. The pisiform lies on palmar surface of triquetrum. The intercostobranchial nerve is the lateral cutaneous branch of second intercostal nerve from T2, innervating the skin of medial surface of arm. Superior lateral cutaneous nerve is a branch of axillary nerve. The pectoralis major, pectoralis minor, subclavius and serratus anterior are anterior thoracoappendicular muscles. The pectoralis minor stabilizes the scapula by drawing it inferiorly and anteriorly against thoracic wall. Latissimus dorsi, teres major and subscapularis medially rotate the arm. Infraspinatus and teres minor rotate the arm laterally. Deltoid is unique in that its anterior part rotates the arm medially and its posterior part rotates the arm laterally. Supraspinatus initiates abduction of arm. Deltoid becomes fully effective as an abductor following the initial 15 degrees of abduction. Serratus anterior rotates the scapula, elevating its glenoid cavity so that the arm can be raised above the shoulder. Brachial plexus is formed by the union of ventral rami of C5 through T1. Lateral pectoral nerve is an infraclavicular branch of brachial plexus originating from the lateral cord. Quadrangular space is bounded superiorly by the subscapularis and teres minor, inferiorly by the teres major, medially by long head of triceps and laterally by humerus. It contains the axillary nerve and posterior circumflex humeral artery. Suprascapular nerve innervates the supraspinatus, infraspinatus and glenohumeral joint. Long thoracic nerve originates from C5, C6, C7. The brachialis originates from distal half of anterior surface of humerus and inserts on the coronoid process and tuberosity of ulna. Dorsal scapular nerve innervates the levator scapulae, rhomboid major and rhomboid minor. Trapezius, latissimus dorsi, levator scapulae and rhomboids are extrinsic shoulder muscles. Deltoid, teres major, supraspinatus, infraspinatus, teres minor and subscapularis are intrinsic shoulder muscles. Trapezius is innervated by spinal root of accessory nerve and is composed of three types of fibers. Superior and inferior fibers of trapezius act together in rotating the scapula on thoracic wall. Supraspinatus is the only rotator cuff muscle that does not rotate the humerus. The scapular artery arises from third part of axillary artery and supplies the muscles near scapula and humerus. Deep artery of arm accompanies the radial nerve through radial groove and passes around the body of humerus. The deep and superficial branches of radial nerve are within the floor of cubital fossa. Brachioradialis is the flexor of forearm, but it is in the extensor compartment and is innervated by radial nerve. All muscles in anterior compartment of forearm are innervated by median nerve except for flexor carpi ulnaris and medial part of flexor digitorum profundus. Flexor carpi ulnaris and medial part of flexor digitorum profundus are innervated by ulnar nerve. Palmaris longus tendon is a guide for locating the median nerve of wrist. Flexor pollicis longus is innervated by anterior interosseous nerve from median nerve. The snuff box is bound posteriorly by tendon of extensor pollicis longus. Radial nerve innervates brachioradialis and extensor carpi radialis longus below, giving of deeper branches. A recurrent branch of median nerve innervates thenar muscles. Palmar cutaneous branch of median nerve innervates skin of lateral palm. Sternoclavicular joint, which does not dislocate easily, is a saddle type synovial joint but functions as ball and socket joint. Wrist and radiocarpal joint is a condylite type of synovial joint. Metacarpophalangeal joint are condylite type of synovial joint. Interphalangeal joints are hinge type of synovial joints. Acromioclavicular joint is a plain type of synovial joint and is strengthened by acromioclavicular ligament and coracoclavicular ligament. Right clavicle is usually shorter and stronger than left one. All carpometacarpal and intermetacarpal joints are plain type synovial joints except for carpometacarpal joint of thumb, which is saddle joint. Long thoracic nerve damage results in winging of scapula. Injury to thoracodorsal nerve leads to paralysis of latissimus dorsi. Injury to dorsal scapular nerve leads to paralysis of rhomboids. Damage to axillary nerve leads to disappearance of rounded contour of shoulder or deltoid atrophy.